symptoms that a lot of women experience when they go through menopause. So menopause is a time in our life that all women experience where we experience a lot of significant changes to our bodies. A really, really commonly reported change and symptom that women get as they progress through menopause is some changes with their bladder and bowel function. So one of the main things that we hear as physiotherapists is that we get an increased urge to go to the toilet and we start to urinate really, really frequently throughout the day. Now obviously this has a lot of side effects. One of them is that it's annoying to feel like you need to go to the toilet all day. Another thing is that it starts to change the way that our bladder and our brain communicate, which can lead to more significant problems down the track. So a lot of the really common symptoms that we hear about, firstly is what we call stress incontinence. So this is what happens is when we get a little bit of urine leakage, when we cough or sneeze. Often it's also associated when we pick up grandkids or pick up a heavier weight, we experience a little bit of leakage in our bladders. Another one that's really common is leakage on the way to the toilet. So you might suddenly get a really strong urge to go to the bathroom and you might find that you're just not quite making it before your bladder starts opening. Other symptoms that are really common as well include difficulty holding in flatulence or feeling like you really, really need to rush to the toilet to open your bowels. Some other things include frequent UTIs. That can be a bit of an indicator that maybe your bladder habits aren't as good as what they can be. As physiotherapists, what we do is we can teach you some really great ways to have healthy bladder and bowel habits, which is something that we aren't ever really taught about and often don't try and learn about until we experience some urinary or bowel symptoms. Another thing we can do is give you some exercises to really help strengthen your pelvic floor so that you don't experience any of those episodes of leakage, or you might get a little bit scared to laugh with your friends or pick up grandchildren and things like that for fear that you might have an accident. So as physiotherapists, our role is really to figure out exactly where your symptoms lie and what we can do to help you get back to 100%. Urinary and bowel incontinence is not something that anyone should have to live with. So if you are experiencing any symptoms, I would encourage you to seek help as soon as you can. Because what we do know is that about 70% of people who experience bladder or bowel incontinence don't actually ever seek help. And this just leads to the problem getting worse and worse. So if you are having any symptoms, please give us a call. There's always something that physiotherapy can do to help improve your symptoms. Thanks guys.